Our next guest is a recorded video from Miss Becca Meadows of the United Kingdom.
Good evening. I'm sorry I can't be there in person to present my research, so I hope I can share in the next 10 minutes via this recording a new piece of research conducted by both myself, Rebecca Meadows. I'm a registered nutritional therapist, but also a master's student in nutritional therapy at the University of Worcester. And alongside my supervisor, Miranda Harris, we conducted a systematic review and meta-analysis of observational studies looking at a vegan diet and pregnancy outcomes in both the birth person and the neonate. So why did we conduct this research? Many of you might already be familiar with the fetal origins hypothesis put forward by Barker in the 1980s. This promotes an association with pregnancy diet, not only in the neonate born from that pregnancy, but also in the next generation of offspring, showing that pregnancy diet is particularly important in terms of public health impact and consequences. When you combine that with a 400% increase in the number of 18 to 24-year-olds in the United Kingdom identifying as being vegan, you can see that this is potentially going to be a significant area for public health to be interested in. It then is rather surprising when you look at the National Institute for Health and Care Excellence here in the UK to see that their maternal and child nutrition guidelines don't contain any recommendations or reference to a vegan diet either during pregnancy or in childhood. So after a title and full text screening, we had 6 observational studies which we included in the review and took forward to meta-analysis. And the aim of this study really was to try and advance this gap in understanding and quality of evidence, looking specifically at a vegan diet and pregnancy to support nutritional strategies for not only improving the dietary practice of vegans, so allowing people to make an informed choice, but also perhaps the other way in terms of looking to see if there's possibly any benefit of a vegan diet during pregnancy, and therefore some dietary implications that might be relevant to omnivorous birth persons, not just vegan. So very much looking on both sides there. We did this with 2 key objectives. The first one being evaluating the relationship between a vegan diet and both birth person and neonate health markers during pregnancy, and we'll come on to discuss what markers those were. And then objective 2 was to really take forward the evaluation and hopefully from that be able to propose nutritional strategies for both nutritional therapists, but also wider for healthcare practitioners to support informed dietary choice for those trying to conceive and those who are pregnant. So how did we do it? The methodology. So firstly, we registered the systematic review on Prospero, and then I conducted a search on 3 online databases looking at CINAHL, Medline, and PsycInfo. I then also conducted a systematic search of all non-indexed literature. We conducted title and abstract screening and also full text screening in duplicate against a number of inclusion and exclusion criteria. One of the main inclusion criteria being that it must cover one of our outcomes. So the primary outcome being neonate birth weight, but then also a number of secondary outcomes. In terms of the neonate, we also looked at preterm birth, small for gestational age, gestational length, and then from a birth person perspective, we looked at the risk of maternal anemia, gestational diabetes mellitus, pre-eclampsia, depression, and also pregnancy-induced hypertension. After having conducted the screening and full text screening, we then conducted a risk of bias assessment using Robbins E quality assessment as outlined in Cochrane Handbook. And effects sizes were then calculated using the standard mean difference method and combined using a random effects model. After this, we conducted I-square tests to look at heterogeneity and also a final grade assessment to determine the strength and certainty of our evidence. So what did we find? The results. There were 6 studies that met the inclusion criteria and were able to be taken forward into meta-analysis. This resulted in a cumulative number of 2,269 neonates, 527 neonates born to vegan birth persons, and 1,742 neonates born to omnivorous birth persons. The only outcome, either neonate or birth person, of which we found a statistically significant relationship was in terms of neonate birth weight. And here we found that there was a reduction of 120 grams in birth weight of neonates born to vegan as opposed to omnivorous birth persons. And you can see there that that's to a 95% confidence interval and with a p-value of 0.03. However, the meta-analysis did have particularly high heterogeneity, an I-squared of 86%, and funnel plot and subgroup analysis were not conducted due to the small number of studies that were able to be taken forward to meta-analysis. There were no statistically significant relationships found with any other neonate markers. So although we did conduct meta-analysis on low birth weight, gestational length, preterm delivery, and small for gestational age, none of these produced a significant relationship. No meta-analysis at all was possible in terms of birth person outcomes, as there was only ever single studies relating to each birth person outcome. Overall, the studies had a high risk of bias, and the grade assessment came out as very low. So what can we take from this? What does this mean for us? As mentioned, the study suggests that there may be a reduced birth weight in babies born to vegan birth persons compared to birth persons eating an omnivorous diet. However, what's really important to make clear is whilst there may be a reduced birth weight, what this study can't do is draw any conclusions over the level of risk that this reduction in birth weight actually presents to the neonate. Also, I think it's really important to highlight the fact that there is insufficient research with single studies only for each outcome to consider the impact of a vegan diet on birth person outcomes. There was insufficient research to be able to come up with anything in terms of the impact on the birth person. So whilst we can't draw any conclusions over the level of risk, the small relationship that we did find in terms of reduced birth weight suggests that some level of education and nutritional therapy support to pregnant vegans could be worthwhile and perhaps an opportunity for more of an integrative approach to obstetric care. From these conclusions, what we wanted to do was try and pull forward a number of suggestions or considerations for the National Institute for Health and Care Excellence here in the UK for their maternal and child nutritional guidelines, which are due to be updated quite soon. And this is recommendations that could be implemented by both nutritional therapists and wider amongst the healthcare provider community. And based on the fact that the relationship that we found was small and with high heterogeneity, the recommendations that we come up with are predominantly non-invasive and are deemed to be low risk and of low cost to implement. So the first recommendation would be to be able to signpost and direct pregnant vegans to standard guidelines on vegan dietary recommendations and considerations during pregnancy, as this currently does not exist in the UK. Secondly, we recommend greater healthcare professional education on vegan diets and common deficiencies caused by excluding animal products. And then thirdly, suggest that more as routine, healthcare professionals consider micronutrient status testing of all vegan birth persons beyond simply iron, which is already tested in the UK, and looking also at serum B12 status, with B12 being one of the other micronutrients or one of the only micronutrients only available in animal food sources. Future research, again, we really need to be able to articulate what this reduced birth weight actually means in terms of risk to the neonate. We need better quality, larger scale observational studies, really looking at birth person outcomes, prioritizing hypertensive disorders as the most significant morbidity risk to during pregnancy. Thirdly, longitudinal cohort studies looking at the long-term health impact of a vegan diet during pregnancy would help guide public health policy slightly more effectively. I'm sorry I'm not there to answer any questions. If anyone would like to forward any questions through to me, please feel free to get in touch via my email or via my website. And Miranda Harris, my supervisor's email, is also there. The QR code will take you to my poster and my research and provide a DOI. Thank you very much.
Thank you very much, Dr. Becca Meadows.